Hey, it's me, Dr. G. So, I read an article over the weekend that was published on July 10th by the JAMA Network, which is part of the American Medical Association. It was very interesting, I must say, so I thought I'd share it with you. In the article, Mask Exemptions During the COVID-19 Pandemic, A New Frontier for Clinicians, the authors sought to analyze medical and legal standards to guide the debate that is taking place nationally. They did this by looking to see if there is any published evidence or guiding principles for clinicians on how to approach a request for a mask exemption. They started out by just looking at what the Centers for Disease Control and Prevention, CDC, has recommended regarding face coverings in public to mitigate the spread of COVID-19. CDC guidelines apply broadly to all people older than age 2, unless they have difficulty breathing or are incapacitated. They conclude that there just isn't enough evidence, quote, as to what conditions may warrant a medical exemption from, end quote, the CDC perspective. From a 30,000-foot view, we know based on previously published studies by Liu et al., community use of face masks and COVID-19, evidence from a natural experiment of state mandates in the U.S., published in the journal Health Affairs, and Chu et al., physical distancing, face masks, and eye protection to prevent person-to-person transmission of SARS-CoV-2 and COVID-19, a systematic review and meta-analysis published in the journal The Lancet, that masking is effective at preventing viral spread by protecting the public and the mask wearer as well. The question remains still about what a physician should do if an individual presents to the office requesting a mask exemption. Personally, I have yet to be asked for one by any of my patients, but I think it boils down to individual disability. Having a specific disability, the authors gave examples of physical facial deformity, physical inability to put on and remove a mask, or even sensory processing disorders in children could permit medical grounds for a mask exemption. However, if I were approached by one of my patients, I would make sure to scrutinize both the specific medical condition and the specific scenario he or she would find themselves in as it relates to mask wearing. If this individual wanted to be mask-free in a physical workplace, for example, then I would certainly make sure that this person has alternative options for work in place, such as, quote, remote work, placement in non-public facing positions, or under certain conditions, leave of absence, according to the authors of the journal article. Employers have complete say in their own masking policies for employees, as I discussed on my Workplace Safety and the Era of COVID-19 podcast that I hosted last month. Check this out, as it was a really solid episode, and I have included the link to it in this post. The best interests of public health must be maintained at all times. Just like there may be some unique grounds for medical exemption to masking, there are also legal grounds too. As stated by the authors of the JAMA Network article, a medically necessary exemption from masking is considered a disability modification under the Americans with Disabilities Act, ADA. This means that people with a verified medical disability are afforded legal protections under both state and federal law. Reasonable accommodations would have to be made, just like in the example I cited above, but this doesn't mean that everybody can petition their doctor for a letter of medical exemption. Doctors are obligated to listen to and evaluate all of the medical concerns of their patients. When it comes to masking exemptions during a global pandemic, though, we as a profession have no obligation to provide such an exemption if it is not medically warranted. However, if an individual does have an irrefutable and verifiable medical disability that supports masking tolerance, then the best path forward is to clearly advise him or her of any appropriate alternatives for risk reduction and maintenance of health if they truly have to go out in public. Peace out.